Namaskaram. Today we have with us Dr. Krishna Prasad, MBBS, MD, consultant physician from Hyderabad. Doctor will be sharing some important tips on how we can manage diabetes effectively and maintain a healthy lifestyle. Doctor, what is diabetes and why is it becoming so common today?
Diabetes is a chronic medical condition in which the body either does not produce insulin or cannot effectively use the insulin that it produces. Insulin is a type of hormone that is made by the pancreas. The types of diabetes are type 1 diabetes, where the body's immune system mistakenly attacks and destroys the insulin producing cells in the pancreas. Type 2 diabetes, where the body becomes resistant to the insulin or does not make enough of it. Gestational diabetes, which occurs during pregnancy and usually goes away after the childbirth.
Doctor, can diabetes really affect people who look fit and healthy?
Overweight is a well-known risk factor. It is not only one. Many lean or athletic people are surprised to see that they had been diabetes or in a pre-diabetic phase. You can be slim on the outside but with a fat inside. That is a condition called as TOFI, which means that the thin outside with a fat inside is a more dangerous condition than the fat under the skin, which can raise the blood sugar levels. The stress and lack of the sleep, lack of regular movements like the long periods of sitting blunt the body's ability to use the insulin properly.
Doctor, what are the early signs that someone might be diabetic?
The early signs and symptoms of diabetes include the frequent urination, that is the polyuria, increased thirst, that is the polydipsia, increased hunger, that is the polyphagia, the fatigue and the low energy levels, the slow healing wounds and the frequent infections, the blurry vision, tingling and the numbness sensation of the hands and the feet or the fingers, unexplained or the sudden weight loss, dry mouth or the itchy skin, mood changes or the difficulty in concentrating on things.
Doctor, why is it important to test your blood sugar regularly even if you feel fine?
Uncontrolled diabetes affects the heart and the blood vessels, that is the cardiovascular system. It increases the risk of heart attacks, strokes, high blood pressure and poor circulations. That is a peripheral artery disease. The brain, it causes the stroke or the memory problems, blurry or the distorted vision, floaters or even blindness. The kidneys, it causes the diabetic nephropathy, thereby it causes the protein leakage in the urine and eventually leading to the kidney failure.
Doctor, how does uncontrolled diabetes affect other parts of the body?
Choose whole real foods, that is always fill your plate with vegetables, whole grains, lean proteins and a healthy fat, and focus on the fiber rich foods. Cut down on the sugar and the refined carbs. Manage stress by trying deep breathing, yoga, prayer, nature walks, etc. Have an enough quality sleep of at least 6 to 8 hours per night. Stay hydrated by drinking at least 6 to 8 glasses of liquids per day. And if at all you have the habits of smoking or then alcohol, try to cut down them or limit as much as possible.
That was Dr. Krishna Prasad guiding us with valuable insights on diabetes management. Stay aware, stay healthy, and let's take a step towards a diabetes-free future. This message was issued in public interest by IPCA Laboratories.